Hi everyone, and happy Monday evening. I hope your week is off to a great start. You probably all know me by now, but I am Erica Desper, the founder of Confident Parenting. I and my colleagues, we help families get more sleep, tackle potty training, and also help families connect with any other resources that they may need. And we are here tonight, our Ask Us Anything question and answer series for expecting, new, and veteran parents. And our guest tonight is joining us right now. Hello, Dr. Britt.
Hello, how are you?
Good, how are you?
I'm doing very well. Just two of three kids are asleep, so one might end up walking down the steps and saying hi.
That's a win, that's a win. Well, I haven't even introduced you yet, so let me do that. This is Dr. Kevin Britt. He is a father of three. I was going to ask if I was right about that, but you said two or three were down, so I'm right about that. And the owner of Focused Chiropractic in Chalfont, Pennsylvania. Dr. Britt specializes in pediatric, prenatal, and family care with a special emphasis on neurodevelopmental challenges. Also happens to be my son's chiropractor. And I'm really excited to have you here tonight because I have learned so much from you, and I really want my families to benefit from your wealth of knowledge and experience too. So thank you so much for making the time. I know it's not easy.
Well, thank you for having me. It's you know, we say easy until again my 5-year-old walks down and says hi.
Yeah, right. And I'm getting messages from my kiddo in the chat right now. So.
Oh, hey, Toy Master.
Truly a parenting gig we have going on here. Okay, so let's get right to it. I know it's late and everybody's tired, so let's get to some questions and give parents some info. First of all, when I introduced you and I said that you specialize in neurodevelopmental challenges, can you tell parents what that means? And assume that, you know, we're tired and we don't have much brain power left on a Monday night. So layman's terms, please.
Sure. So neurodevelopmental challenges, it's a wide range of things. For the younger kids, it's things like speech delays, motor delays, things like that. And then as they get older into school age, learning disabilities, ADD, ADHD, along those lines. Those are the most common neurodevelopmental issues that we see and can help out with.
Got it. And is it fair to say, and I assume important to emphasize, that not all chiropractors and maybe not even all pediatric chiropractors would have that same specialty?
Yeah, that's a very good question, and yes, that is true. Most of the training that I would utilize, maybe not most, but a lot of it I've had to learn outside of school after my degree, and it's more of just, you know, what my path has led me here because of my own story, and so I've kind of gone down that rabbit hole with myself, and then also with my kids as well. And that's really where I wanted to focus on helping all these other kids, because I know a lot of parents, they start to run out of hope that there is help. And I know chiropractic isn't the first thing that people think of, but it's nice when they finally walk in and understand how it can possibly help.
Yeah, for sure. Awesome. Okay. So that brings me to my next question. And by the way, if anybody watching has a question, feel free to put it in the chat and we will make sure that we get to it. So when we think of chiropractors as humans, adults, and especially parents, we're usually thinking of our own neck and back pain, or maybe an accident or an injury. So can you explain, same caveat, layman's terms for tired parents, how and why could chiropractic care help with, and we can list a whole lot of things, right? And you can emphasize each of these if you want to, but to rattle them off, I would say colic, reflux, chronic ear infections, feeding issues, torticollis, all those things that we as new parents generally encounter with our little ones. What's the connection and how can it help?
Yeah, so I know
that's a lot.
No, it's fine. I always tend to say it's my profession's fault that people think we're neck and back pain doctors. Not that those are obviously things that we help with, and we help tremendously with those. but really we're not spine doctors, we're nervous system doctors, and we help balance the nervous system by working with the spine. That's our closest conduit to the nervous system, to the spinal cord and the brain. And when we can affect the nervous system the way that we now know we can, we're able to help balance the nervous system. And layman's terms, our nervous system has a gas pedal and a brake pedal, right? Gas pedal is the stress response, fight or flight. Most people have heard that, fight, flight, or freeze, which is what we hear nowadays. And the brake pedal is the rest, digest, growth, healing, development, immune function. And we want balance because we want to be able to hit the gas pedal when we can, but we also want to hit the brake pedal when we can. And we know through a century plus of experience, but also through research now, that chiropractic care can help balance the nervous system and get our bodies back into that brake pedal state where we're more relaxed, we're more rested, our body can really start to heal. And when our nervous system is in that state, the rest of our body starts to fall in that state as well, because as most people know, the nervous system controls and coordinates literally everything that happens. So it's
fortunately or unfortunately.
Yeah, exactly. Our nervous system never forgets either. That's the other issue. Yeah.
And speaking of the nervous system never forgetting, and I know some of these questions we talked about in advance and some I'm just throwing at you, so you're doing a great job. Can you repeat for everyone else's benefit what you've explained to me about sort of, I would call it the cascade effect. So let's say there was a difficult pregnancy followed by a complicated birth, followed by colic, like how it sort of transforms throughout a little kiddo's career.
Yeah. So I'll approach it this way. Over 90% of all the kiddos and people that come in with some sort of issue, over 90%, there was, let's just say, a story around either mom's pregnancy or more often around the birth process, some sort of intervention, whether necessary or elected, whatever, it doesn't really matter. And what we find is that those kids tend to start off as, maybe colicky or uncomfortable, or refluxes, silent reflux we're hearing a lot now. And often what's told is, oh, you'll grow out, your kid will grow out of that. And sure, they'll grow out of that current issue, but what we find is that they now, like you said, progress down a cascade. The colicky baby becomes the constipated baby, that becomes the chronic ear infection toddler, that then becomes the autoimmune child, or the fuss. Like everybody has their own cascade, but we find that if things aren't dealt with or taken care of, that they progress down this cascade of worsening symptoms, we can call it, or worsening diagnoses. Luckily, some kids, they grow out of it and it's gone and it's seemingly never back. But for most kiddos, they tend to progress down a path where they just end up with some chronic issues. And that's why we see chronic issues being a big part of what's happening in our country. Yeah. So. Yeah,
for sure. Okay, great. And just before we move on to the next question, so I think it's important to emphasize, because this has been a big learning process for me, a lot of things that we think may have a behavioral cause, or even a cognitive mental cause, like anxiety in kids, or acting out in the classroom, not being able to sit still in their chair, hyperactivity, all of that stuff. If we're solely addressing it from a behavioral cognitive standpoint, we might be missing a huge piece, that there's really a physical root cause that needs to be addressed.
I have nothing to add to that. That was great.
I'm just going to take over. You can tell I'm really listening at our session.
I love it. I agree. Yeah, that's great.
I have wrapped my head around it at this point, but I hope everybody's catching on too. That was really, really eye-opening for me. And, I didn't share my own personal story, but we had that journey that you described with the, difficult pregnancy, slightly complicated birth, very colicky baby, also reflux, and it just has kind of gone and turned into, learning issues in school. And we were addressing them all sorts of ways, but we've seen the most turnarounds now that we've started addressing the physical elements. So that was really, really exciting to find out. Okay, so we know what types of things could be addressed by someone with a specialty in chiropractic care, but let's get to a question that's probably on everybody's mind that's never done this before. What does chiropractic care look like on a tiny human, and is it safe?
Yeah, that's obviously one of the most common questions I get asked. And one, yes, it's extremely safe. And if the joke I always say is don't go on YouTube and type in chiropractic. Just don't do it, because you're going to see some stuff that I wouldn't want done to me, to be honest, but also would never happen to your kid or your baby. Whenever we're adjusting a newborn, especially like a baby, I always say it's the amount of pressure that I'm using is the amount of pressure I would use to test the ripeness of an avocado or a tomato. It's practically nothing. And most of the time parents are like, oh, that's it? And so it's really easy. And
we're children. I can say that my son said the same thing.
Yeah, he's like, that's it? I wanted more.
Right. Awesome. Yeah. Okay, good. So yeah, we don't need to be worried about that. And I love that you explain, obviously you always explain everything you do before you do it, especially for kiddos who are verbal. I think that's really, really important. Okay, so any other common concerns that parents are bringing to you that we didn't already list or touch on? I hope you left anything out.
Yeah, most of the time, like I said, I mentioned it earlier, but most of the time when parents come in, they've already been to lots of other places. And because chiropractic for kids is very uncommon and misconceived, I'll say, the biggest concern is like, how can this even possibly help us? Because they've been to multiple other specialists, other pediatric specialists, other medical specialists, and the biggest concern is just, can this help? Like, how could this possibly help when no one else has? And that makes it tougher, but it also makes it more rewarding when we see these changes in these kids. Because not only that we're seeing them change now, and we're knowing that their family is going to be less stressed as well, but also that we're setting them up for a much, much healthier future.
Right. Awesome. Okay. I'm going to actually do these out of order because I think this makes the most sense to jump into next. So
sure.
Let's say a parent came to you with a child. How would you decide if that child needed, care, and how much do they need? I know that was one of my concerns, is like, we spent years and thousands on treatments. We can't possibly do much more. Are we going to be coming to you for years and years? But I want parents to know it isn't always like that. Sometimes it's like we're going to fix this and then it's fixed, right? Yeah. Certainly not always. Every case is individual. But what are some range of, what you would say for that?
So there's two things that I determine, if chiropractic can help and how much care we might need. And one is the story. So what is the birth story? What is the pregnancy story? What else has happened? What else have you done? What else haven't you done? All of that plays a big role. And then the other thing is the scans that we do. So we do neurologic scans. There's a set of 3 of them. Heart rate variability, infrared thermography, and surface electromyography. And I know there's a bunch of big, scary words, but they're really simple. They're non-invasive, safe for anybody, because we're just reading information that the body's giving us. There's no radiation or anything like that being used. But the amount of information that it gives us is absolutely incredible. For example, this morning I had a 7-week-old, and we were able to get the heart rate variability and this infrared thermography. We can't do the SEMG yet because that you need to be weight bearing, and he's 7 weeks old. But it just gave us a ton of information, so we know exactly where to start and where to focus, and typically how much care we're going to need for them. So as I like to say, I don't guess, I test.
Got it. Okay. And it could be a small number of sessions, or it could be something that can be maintained.
Absolutely. And a lot of people decide to, even after they've done their initial care plan, they decide to get on a maintenance care plan, or a wellness plan, as we call them. For some people, it's once a week. Some people, it's every other week. Or some people, it's once a month. that's all up to personal choice and everything like that.
Okay, great. All right, we have a couple more questions. Anybody else has an additional one? Feel free to throw it in the chat. You have some people, some friends in the chat.
I guess so, yeah.
Lots of hearts getting thrown up there. Okay, so you talked about everybody having a story, and it often is traced back to either the pregnancy or the birth and interventions. And, you know, I would like to throw out there when we're talking about interventions, you know, there's no guilt or blame being placed. Sometimes it's totally necessary, right? They exist for a reason. Sometimes we elect for whatever reason. But what could an unexpecting mom do to set themselves up for a more comfortable pregnancy, or maybe, I know, you know, there's so many variables, but maybe lesser risk of unwanted intervention that might help us avoid some of this?
Yep. Well, I'll start off with the side that I'm biased on. So that's obviously, even while you're pregnant, a lot of moms nowadays are starting to get under chiropractic care before they're even pregnant. Because again, it's all about the nervous system. When we can take as much stress off the nervous system, that's going to take as much stress off the baby as well. Because if mom's in a stress state, that sends all those stress chemicals to baby as well. And then as they're developing, we like to say nerves that fire together, wire together. So as that baby's developing neurologically, they're developing inside of a stressed state. So if we're able to bring the stress levels down for mom, while she's pregnant or even before that, it just sets things up for being even more comfortable during pregnancy, during birth, afterwards. So if that's something people are interested in, I always recommend to look out for a chiropractor who has Webster certification, which is a post school, or you can get it during school, but you can't really get the certification until you're done in pregnancy care for parents and or for women. And then also, whenever someone comes in, I always recommend finding a good doula that you are on the same page with. I recommend, whether you have issues or not, finding a very good pelvic floor therapist. And, you know, try to create that team, because the more people you have in your corner, the better. And nowadays, the more people you have in the corner, you need them there. Because a lot of moms tend to get pushed in a direction that they don't necessarily want to, because they're told that's the only option. And unless you have a really good support team, you'll think that's your only option, when in reality, you often have more than one, more than two options. So my biggest recommendation is to find a good team. And if you need help, there's a whole ton of people who can help you put together a great team.
Got it. Awesome. I love it. Okay. And anything else, any other services that you offer that we haven't talked about yet? Anything else that you want parents to know about you, about chiropractic?
Yeah.
Chiropractic.
Chiropractic, yep. So that kind of piggybacks on the previous question. Is I specialize in chiropractic care. That's what I do. That's what my goal in life is, to be a master at that. And so I always try to network with other like-minded pregnancy and pediatric care specialists, and that's how we connected as well. So I don't offer any other services, but I always want to find, and I have a great network of other specialists that I work with and refer back and forth to. And what I find with most, especially kids on the neurodevelopmental landscape, is when we come at them from multiple angles, they do so much better. They, I mean, just a quick example, there's a kiddo who's coming in, and he was under his speech therapist for 6 months, and he was making some progression, but not much. And once we got him under chiropractic care, opened up his nervous system, helped it calm down and relax and balance, he just took off. And it's because, as I've talked to a number of therapists, like, would it be easier to work with a stressed out nervous system or a relaxed nervous system? I mean, it's pretty simple, but it's very powerful. So I like to make sure that people have the best possible resources, and I'm always trying to build that. And like I said, that's how we initially connected.
Yeah, so I'm so glad that we did. Personally and professionally.
Yeah.
All right. Well, I'm going to let you go in a moment unless anybody that just jumped in has a question for Dr. Britt, throw it in the chat. But finally, let everybody know where they can find you.
Sure, absolutely. My website is Focused Chiropractic, so focusedchiropractic.com. I'm on the socials, primarily Instagram and Facebook. I think both tags, I should have planned ahead, but I believe both tags are Focused Chiropractic. And
you have a lot of great resources on your site, free resources that explain some of this. If parents aren't taking it all in, they can go there and learn a little bit more. I found that helpful. Yeah. Someone's asking who your favorite patient is. You might have to keep that answer to yourself.
It's the patient that I'm with at that moment. I'll keep it PC. Yeah.
Great answer. Yeah. All right. Well, thank you so much for your time. I can't say enough about you, and I appreciate you doing this. Thanks to everybody who watched. We have one more live session next week. It will be with Linda Muller, who is a IBCLC, an international board certified lactation consultant. So we'll be answering all your breastfeeding questions. So this kind of piggybacks into that. I don't see any questions in the chat, so I'm going to let you get back to your third of 3 kiddos that is not asleep yet.
He better be asleep by now. No, I'm just kidding. He's definitely not. He's definitely not. There's no way.
All right, great. Thank you so much for your time. Thanks, everybody, for joining, and we'll be back next Monday at 8 p.m. right here.
Thanks for having me.
Bye.
See ya.